physician, and today I'm going to present this work that was done last year, and it's about the ascorbic acid use in severe traumatic brain injury patients and its impact on the adult intensive care unit stance. It was a job made by myself and also from Hernandez Plata Almaerica, Bravo Santibáñez Edgar, who are both critical care doctors, and also Hernandez González Martalicia, who was our assessor. It was a job made on León, Guanajuato, on the month of October 2020. As conflicts of interest, we don't have any kind of this, none from authors. And, sorry, none from authors. And as an introduction, we have that traumatic brain injury is the leading cause of death and disability in young adults. Management aimed at limiting secondary injury impacts on the morbidity and mortality of this entity. There is a large release of oxygen-free radicals as a direct cause of this damage. This is what it's called the secondary injury on TBI. In addition to its potent action as a free radical scavenger, ascorbic acid can stabilize the endothelium and promote the integrity of the blood-brain barrier. And as we all know, on patients with traumatic brain injury or a critical injury, we have low levels of ascorbic acid on blood. And the objective is to determine if the ascorbic acid used in patients with severe TBI impacts on length of stay at hospital at the adult intensive care unit. As material and methods, it was a randomized open-label clinical trial at the intensive care unit of Centro Médico Nacional del Bajío, UMAE 1 at León, Guanajuato, Mexico. And from April 2020 to July 2020, there were involved 24 patients, 12 on the experimental group and 12 on control group. And by probabilistic sampling of cases with tombola, those patients with severe TBI evaluated by the Glasgow Coma Scale. We use the administration of ascorbic acid, 1 gram IV every 6 hours from admission to the emergency room and during stay at ICU. The entry parameters were the Glasgow Coma Scale, the Rotterdam score, Apache 2 score, SOFA score, ranking, and those who were on brain edema. The measured parameters were the hyperosmolar therapy use, surgical treatment, ICU length of stay, and hospital stay time. Also the Glasgow outcome score and death. As we can see here at the results, the demographic data of the studied population, we can see that most of the patients were male, with 21 of them, and the age was in about the 30s. And that's something to know because it is a pathology that affects mostly young adults. And the comorbidities, as we can see here, only one patient had diabetes and another one had arterial hypertension. Most of the people involved had a Rotterdam score of 3, an Apache 2 of 17, and SOFA score of 8, all of them with a ranking scale of 5. The ascorbic acid use was on 12 of them. Those who were on brain edema were 24 patients, all of them, with midline deviation 18 to 75%, and those who required hyperosmolar therapy use were 21. And the ICU length of stay in days as mean was 5.35, and hospital stay time was 9.22. But the Glasgow outcome scale was 3.57, and those who died were 4 patients. Here we can see the baseline characteristics of study groups, the comparison of means. Those who were on the ascorbic acid use group were 9 males and 3 females, and on the control group were 12 males. As you can see here, the distribution of ages were that on the ascorbic acid use they were younger against the control group with 49.28 years. We can see here the Glasgow Coma Scale at entry. It was 7 on the ascorbic acid use, and the control group was 6.7. Really not a difference. On the Apache 2 score, we can see here that the ascorbic acid use were with a higher level than on the control group with 13.6. And also the SOFA score was higher on these patients with the ascorbic acid use with 11 against 7 on the control group. The ICU length of stay, that was the main objective of this job, was higher on those people who were on the ascorbic acid use group, with 7 against 3.71 on the control group. The hospital stay time was also higher on those on the ascorbic acid use group against the control group with 5.85. As we can see here, the Glasgow outcome scale wasn't really different between one or another group. And finally, death. There was just 1 death on the group of the ascorbic acid use against 3 on the control group. This not being statistically significant, but I will show you something more far. The results were as the comparison of means on length of stay at the intensive care unit and at hospital in the experimental and control groups. Here we can see these graphics that are called boxes and mustaches of the time on the ascorbic acid administration. Those who were administered had a longer stay at ICU, as you can see here, and that's how the distribution was. And also those who were who didn't apply this ascorbic acid. And also on the days of stay at hospital, we can see here the same distribution from one and another group. As results, we have here a risk analysis of the use of ascorbic acid. It was a protective factor with a hazard ratio of 0.128 with a confidence interval at 95%, less than 1. So this is statistically significant. The surgical treatment really wasn't significant. Also, the hyperosmolar therapy was almost the same in both groups. And this, we have this Kaplan-Meier curve to determine survival between study groups. We can see here on the blue line, those who were on the ascorbic acid use, who were as a protective factor, the use of this supplemental against those who were on the control group. They died more than this. Also the discussion, here we have that administration of ascorbic acid in patients with severe TBI had a negative impact at length of stay, both at ICU and at hospitalization compared to control group, being statistically significant. And similarly, there was a decrease in mortality in the experimental group compared to control. Here we saw the graphics before, and also on the Mantel-Cox proof with a P of 0.010. And the administration of ascorbic acid could reduce mortality in patients with severe TBI. But to imply this, we must do a longer study with a lot more of patients. This can be a pilot study. As conclusions, the ascorbic acid use under the context of severe TBI had a negative impact on stay time at ICU, as well as on the length of hospitalization as it prolonged it. No difference was found in both groups in terms of functional prognostic scales at discharge, However, the survival analysis showed a lower mortality at 28 days for the experimental group compared to the controls, being this statistically significant. So, what do we have as new insights? Discussion opens for new protocols regarding the use of ascorbic acid in the context of severe traumatic brain injury, and the basis for an update in an international guidelines are established. So, and as countries who are on development keep the hospital stock with ascorbic acid, could be a good standard. And well, por su atención, muchas gracias. For your attention, thank you very much. Voor of Mark Samkeit, vielen Dank. This is my email. If you want to send me something, or if you want to participate on a longer study, here we can discuss this.